Infigratinib is one of the drugs. It used to be known as BGJ398. That study, or that drug, was actually initially tested in a phase 1 trial in metastatic urothelial carcinoma and had about a 25% response rate. It's now actually going to be, or being tested in a phase 3 randomized placebo-controlled study in patients who have already had surgery for their bladder cancer, but who are considered high risk for metastatic recurrence. And so those patients will receive either infigratinib or a placebo until an invasive recurrence occurs. And of course, those patients too have to have FGFR3 mutations or fusions in order to be eligible for that trial. Another drug that's being tested is rogoratinib, that's been developed by Bayer. And so that drug actually has been tested, or is being tested, in patients with metastatic urothelial carcinoma who have FGFR3 overexpression. So it's a little different than the other drugs in that it's not looking specifically for mutations or fusions, but rather overexpression using an RNA-based assay. And so patients who have overexpression may be potentially eligible to receive the drug, and that's also being tested in the metastatic setting, but also in the first-line setting in patients who are cisplatin ineligible. It's being tested in combination with immunotherapy. So those are two drugs that are being tested. Pemigatinib is a third drug also being looked at in the metastatic urothelial setting, and there's also a drug from AZ as well, that's AstraZeneca, that's also being looked at in combination with durvalumab and also by itself.